Hey y'all, Shelley here with another tip for hospice nurses. So I had a request to do a video on constipation, and it's taken me a little while to do this video because there's so much to say that I decided what I'm going to do is give some tips on what I do. But there's a lot of different things out there that work, and y'all know what works for some people doesn't work for others. So if you have a tip that works great for you, please share it in the comments because we can all learn from each other. Now, I'm not going to talk about the general bowel regimen and all of that stuff. We all know all of that. But let's say the bowel regimen isn't working. So what am I going to do? Like I'm on day 3 or 4 and the patient hasn't had a bowel movement. They're starting to have some symptoms from it. I'm going to call the doctor, and I'm probably going to ask the doctor if we could try Miralax, because that's one of my favorite things to do for my patients with constipation. I like it for a couple of reasons. One, it's very easy to give. You put 17 grams, or basically a capful, in a fluid, and they drink it. It doesn't have any taste, so it doesn't change the taste of the fluid. It only slightly changes the viscosity of the fluid, but most people kind of like it. And you can put it in coffee. So that works really well because most of our patients are going to drink their cup of coffee in the morning. Because whatever you do put it in, they have to drink the whole thing. So it works really well in coffee. I've heard of putting it in food like pudding or jello. I've never actually done that, but I've heard of people doing that. And that's supposed to work well too. But I like it also because it's not like a stool softener works by pulling fluid into the stool. Miralax is an osmotic stool softener, so it works by actually pulling fluid into the gut. So it kind of bathes everything in the fluid, but also in the process is a slight stimulant. So it can stimulate a bowel movement, but it's not a stimulant laxative. So it's not going to cause cramping or any side effects or anything like that, but it can kind of help things to move along better. So it generally works pretty well. Another thing that works well, about 80% of the time, 70 to 80% of the time, is warm prune juice. So warm, not hot, but warm like you would warm a baby's bottle. And like I said, it works about 70 to 80% of the time, but when it doesn't work, it doesn't work. So I'll try the prune juice maybe twice. And if there's no effect, I'm calling the doctor again to try something else. The doctor is probably then going to go with some kind of a stimulant laxative, either by pill, or if it's really need to get things moving along, the doctor may order lactulose or mag citrate. Now, both of those are probably going to have some pretty dramatic results. So you want to be prepared for that. You want to make sure the patient has quick access to a bathroom. You have pads in their chair, maybe even a diaper on them, barrier cream, lots of wipes. Just be prepared for excess results. Now, lactulose, in my experience, most patients don't complain of the cramping as much with lactulose as they do with the mag citrate. But a lot of people do not like taking it. It's thick, it's sweet, it's sticky, and they just don't like it. Where they might prefer the mag citrate, which is just a liquid that's kind of like a carbonated liquid that they drink, that's not too bad. So it's whichever works best for your patient. So one more caveat to think of here is we want to make sure that we treat the patient and not the number. So not the number of days that they haven't had a bowel movement. If I go in and my caregiver's like worried, haven't had a bowel movement for 6 days, but I'm looking at the patient, they're in the bed, they're essentially unresponsive, not really drinking or eating, but their abdomen is soft, it's flat, they don't seem to have any discomfort to palpation, probably not going to do anything because the patient's probably in that pre-transitional phase, and we're not going to do anything that's going to cause them discomfort, and they're probably not going to have a bowel movement anyway. Likewise, some people, it's just normal. They may not have a bowel movement, but like once a week. So if they're not having any symptoms and they're like, well, this is kind of normal for me. Okay, so we're just going to watch it closely. I am going to notify the doctor so the doctor's in the loop on it, but they may not want to do any interventions. Treat the patient, not the number. So I hope this tip was helpful. Again, if you guys have any tips for what you do that works good for constipation, please share it in the comments. And y'all remember, if we work together, we can change our world.